Okay, Dr. Adriane Wynn is an assistant professor in the Division of Infectious Diseases and Global Public Health at the University of California, San Diego. Her primary research interest is in identifying and managing sexually transmitted infections during pregnancy, with a focus on assessing costs, benefits, and cost effectiveness of interventions. More recently, she obtained our KO1 Career Development Award through NIAAA, which supports training on the relationships between alcohol use and HIV, as well as integrating infectious disease modeling with cost-effectiveness analysis. She received her Ph.D. in health policy management at UCLA. She was also a postdoctoral fellow on the NIDA-funded T32 in substance use, HIV, and related infections at UCSD. And she is our GloCal Health Fellow. So it's a great pleasure to introduce our speaker, Dr. Wynn. And as usual, I encourage you to ask questions, put them in the chat as Dr. Wynn shares her experience. And then at the end, we can go over the questions and also ask questions at the end. So welcome, and let's take it away.
Great. Thank you so much. Should I share my screen?
Sure.
Okay. Looks like I need permission.
Let me see. Christine, do you have?
Oh, yeah. Sorry about that. Give me a quick moment.
No problem. Well, I'm really happy to be talking to everyone today. I'm very grateful to have been a participant in the GloCal Health Fellowship Program. Let's see, here we go. That year of mentored support has been kind of integral in terms of developing collaborations and starting projects that I'm still working on today. So I'm really grateful to have been able to participate in that program and to talk to you. So today I'll talk a little bit about my career trajectory, and then most of the presentation will be talking about kind of the long journey to getting the K Career Development Award. So just quickly a little bit about me. It's been a bit of a winding road. So I started off as an undergrad at UC San Diego. So I've kind of come full circle. After UC San Diego, I spent a year in Cape Town, South Africa, where I worked for this American nonprofit that ran youth and kind of recreational activities that tried to address different health and social challenges. And through this experience, I learned that I really loved Southern Africa, but also it became obvious to me how important public policy was for people's health and people's lives. So from decisions about whether to make antiretroviral treatment for HIV accessible in South Africa, to whether the US government was going to continue funding this nonprofit that I worked for, public policy became something I was really interested in. So I decided to go home and try and become more involved in policy. So I started off working at the California State Legislature in Sacramento, but decided that I was more interested in national policy and international policy. So I moved to DC and worked for my home state Senator Dianne Feinstein. And as a legislative aide, unless you enter kind of with a specific area of expertise, you're often just kind of given you work your way up to work on these different issues that you may not have a choice in. So I was working on budget and like cleaning up abandoned mines and all of these different topical areas. But I was finding that people who were working on the issues that I was most interested in, like healthcare and international development, had higher degrees. So I decided to apply and go back to school. And that's where I got a master's in public policy at UCLA. And my master's thesis was about the accessibility of nutrition support among people living with HIV in LA County. So that's where I sort of got involved in research in LA County. And sort of through this program, I remembered how much I loved statistics and econometrics and coming up with questions and conducting research. So I decided to just continue on and get a PhD at the UCLA Fielding School of Public Health. And my PhD research, as was mentioned in the intro, was about sexually transmitted infections during pregnancy. And I had the opportunity to go to Botswana just for like a month at a time through some connections that my mentor at UCLA, Jeff Klausner, had. And I was kind of expecting to work on HPV screening and vaccinations, but after meeting Dr. Doreen Ramahola Masire and Chelsea Maroney, I realized that there's a gap in research in terms of whether to screen for curable STIs like chlamydia and gonorrhea during pregnancy. And so many countries don't screen for those STIs. They rather treat based on symptoms, which can be problematic as these infections are often asymptomatic, and untreated infections are associated with infertility and other adverse birth outcomes. So then my PhD was just based on this little pilot study, kind of assessing what are the prevalence of these infections, as it hasn't been measured in a long time, the acceptability, feasibility, and costs of testing. And we found that infections were prevalent, and participants and providers were willing to get tested and be treated. And we used a point of care STI testing assay, which was interesting. But so because of this, costs were high. And so it was actually this early research and collaborations that inspired me to apply for the GloCal program. So I was able to take these findings from the PhD and collect more costs and inputs from Botswana and model the cost effectiveness of different strategies for STI testing. So point of care versus lab-based strategy versus mixed strategy nationally across Botswana among pregnant women. And then kind of stratifying by HIV status. And simultaneously, as I applied for the GloCal Fellowship, I also applied for the UCSD 232 postdoc in substance use and HIV that's funded by NIDA. So I spent the first year of my postdoctoral program in Botswana doing the GloCal project. And then it was 1 to 2 years after that where I was a postdoc at UCSD. And so while at UCSD, I identified a mentor, Natasha Martin, who's also involved in the GloCal program, who's an infectious disease modeler and economic modeler as well. And so she's kind of been on this journey with me to get the K grant, which I eventually did in 2020 and was hired as an assistant professor at UCSD. And then I also kind of maintain a collaboration with the Botswana Harvard AIDS Initiative as a research associate. And I have other grants going on in Botswana through CFAR, and then we had an R21 that just finished. So that's the story so far. But I'm gonna kind of go through how this whole process unfolded to get the K. And I don't know if people are able to raise their hands or mention if a K is something that's of interest to them, or they think they might apply, or an R. Are people thinking of applying for grants right now?
Yeah, I think folks can just chime in using the chat function. And I think, beyond the GloCal Fellowship, yeah, so Marguerite just said she's applying for the Fogarty K01. So I think this discussion is really relevant.
Great. Okay. I'm just going to read the definition. So the NIH Mentored Research Scientist Development Award is to provide support and protected time for an intensive supervised career development experience in biomedical, behavioral, or clinical sciences, leading to research independence. But so there are a number of different types of Ks. The K01, which is what I have, which is 3 to 5 years of mentored salary and support. The salary and support and research funds differ by institute or center, so you will want to pay attention to those differences. For example, like NIAAA and NIDA pay $90,000 in salary support and $50,000 per year in research, whereas others pay $75,000 per year for salary and $25,000 per year for research. So that's an important difference. For clinicians, there's the K08 and the K23. And it's a little confusing to me what the differences are, but the K23 I know is supposed to be patient-oriented research. And I have a friend who just got a great score on a K08, and she initially thought she was going to do a K23, but after speaking with the program officer and the mentor, they kind of routed her the other way. So if you're deciding between those two, I think that's a discussion probably for your mentor and program officer potentially. And then there's the K99, which is a 5-year award for postdoctoral investigators transitioning to independence. And so it's 2 years of mentored postdoc, I believe, and then 3 years of independent research. And the thing about this award is that you don't have to be a US citizen, whereas you do for the others. And there are a bunch of other career development opportunities. The Veterans Administration has programs, and then also different universities have programs as well. And then here are just the basic application components that you're scored on. And this is my friend's guacamole recipe, by the way. But so looking at the candidate. So is this somebody has a successful track record where a grant will get them to become kind of an independent researcher and a leader in their field? And then you have 6 pages where you're proposing a training program where you also have aims and content that you're proposing to be trained in. You have a 6-page research plan, which is like any other grant sort of, where you have typically your 3 research aims. And then you have the mentors. So people will be looking at your mentors' expertise in the areas where you want to be trained. Do they have a track record of mentoring? Do you have all of the kind of gaps in your training being filled by your mentors? And then looking at the environment and institutional commitment to the candidate, so your university and their commitment to you. And then there's also a training in responsible conduct of research component. And so here is my timeline. So I started as a postdoc in September of 2017, and I spent the year in Botswana. And then in that year, I put together a K and submitted in September 2018. You get your scores back. It's like 3 to 5 months later. And sadly, this one did not do very well. It was not discussed, which I'll talk about in a minute. And then so I decided to submit a new one 5 months later to NIDA. Got the score back. It was sort of more like 3 months later. It did pretty well. So I resubmitted that grant with some revisions, got the impact score back in December. It did worse, sad, and then decided to, as sort of a Hail Mary last-ditch effort, submit the initial grant that I submitted back in 2018. It did very well, and it was funded. So I know that everyone's journey is kind of different. Some people do get it on their first try. Some people have taken longer than me, but I don't know that. I don't know. It's probably more common to be 2 times or 3 times. So I'll kind of go through the lessons learned for each of the grants that I submitted. So just in general, obviously starting early is important. I wouldn't assume that you will get the grant on the first try, but maybe you will. First, review the institute or center strategic plan and research priorities to help you kind of develop what your aims will be. Kind of envision how this grant will propel your career forward in terms of what you've been doing, and then how will this new training and research program make you better suited to be kind of an independent researcher. And then get as much feedback as possible from as many reviewers as possible. Do mock study sections. I know that UCSD's CFAR has an OK review where they do a mock study section where you can sit in and you can't participate or say anything, but you can kind of hear everyone's feedback. And this happens usually like a month or 2 months before the final deadline. So then you can take the reviews and make updates to your grant. Some of these things are a bit obvious, but download all the instructions from the website, know all of the deadlines, create your own internal timeline. Work on selecting your faculty team. It might start with one person, and that person can help you kind of build out the team. Draft the specific aims, and it's helpful to circulate at least 6 months before the deadline. I think this might be true for ours as well. And keep in contact with the program officer at the institute or center that you're interested in applying to. So you can send the revised specific aims and your CV or biosketch to them, and have a chat about your candidacy and your aims and how they fit into the institute or center's goals. Think about, do you need any preliminary results or authorships before you submit? Review as many K applications from colleagues as possible. CFAR has a repository. I know a lot of people that would be willing to share their applications. I mean, I would be willing to share my successful one or any of the failed ones if anybody would like. I know that a lot of GloCal alumni would probably be willing to share as well. Find your institution's administrative contacts, so the people that are going to help you with the budget, the pre-award office, because they'll have an internal deadline. Usually that's a bit earlier than the official NIH deadline. And then start requesting your letters of reference. You'll need a letter from your university. And then if you're a postdoc, you'll need a PI exemption to be PI on a K. And this is this isn't actually my Dropbox, but it's similar to what it looked like, but just kind of stay organized because there are so many components to K grants, to R grants. So from project summary, equipment, you need everybody's bio sketches, you need all the different components of the grant, you need letters from your mentors, you need letters of reference. So just staying really organized. And then here is a timeline from one of my grants that I put together, but it was due May 7th. So I kind of sent out the specific aims in January and worked on getting a draft of all of those components in January. A lot of the other like bio sketches, letters, I suggested getting those done in March. And then the OK review took place April 10th. And so you needed to have everything submitted to them. And then HISPO is the pre-award office at UCSD down at the bottom. And so you need to submit kind of your budget, letters, documents to them quite a bit before the final NIH deadline. Then you get revisions from them and you make changes and they'll help you submit to NIH. But I would suggest adding another column actually and having the dates that you'll distribute things to people and then the dates that you expect them to come back from people. So that's kind of helpful. So, okay, well, so go through my first grant. This is just a screenshot from the summary statement or the pink slip, however people call it, but it comes back to you usually a few months. It's been coming back pretty fast, actually, for me. I think this came back within a month. So just your name, organization, the institute you applied to, the title, modeling the impact of alcohol use on HIV and HSV2 incidents in Rakai, Uganda. And then the two pluses are sad. It means it was not discussed. So it didn't make it into the top 50% of applications. So your application will still go to 3 people to review. And they'll give you feedback, but it doesn't get brought up during the study section meeting. They only discuss the top 50%. And so some things that I learned from this application were balancing experience with training needs. So potentially it was too early for me to apply for this. They said I had a low publication rate, questions dissemination in the future, although I had 4 in 2018, which suggests an upward trajectory. I hadn't yet, the publications in alcohol hadn't been published yet. So I didn't show that I was kind of building in a track record of research in alcohol use. And then I also didn't have a training module specific to learning about alcohol use research. So it's kind of, for some people, it's a fine line between having too little and too much experience. If you have less than 5 publications, it might be premature. I think I had 11 at the time, but I guess we're feeling, I think it was only 5 first authors. So they were feeling that it was a low publication rate. But I think once you start getting up to 20, then depending on what your papers are on, you can also go the opposite side where people will say, oh, this person has too many skills, they don't need to be trained. But so it's kind of just showing that you're developing a track record in the field. And then if you do have gaps, work on filling those with the training aims. And then I think this is too much text, but this is, if people want to look at this later, basically going through, this was for the final grant that got funded, kind of going through all the training aims, explicitly saying what my training has been in and what I want to achieve next, and kind of how I have some background, but I'm learning new things as well. The right mentorship team. So they said that mentor blank is junior, currently on a K, has no experience mentoring K1 awardees. This other person did, I think they think that this other person was junior, hadn't mentored K1s, but actually had and just didn't say it enough in the bio sketch and in the letters. And then the mentorship structure is unclear, like when are you meeting? Are you meeting weekly, bi-weekly? I think maybe there was inconsistencies in the letters. And then plans for monitoring and evaluate the candidate's progress are unspecified. So you really do need a strong mentorship team. Your primary mentor should be senior with demonstrable mentoring experience, and their experience should be listed in their letter. It should be in their bio sketch. It should be in like the training aim section. They even sometimes include a table listing all of their mentees and where they started mentoring them and where they are now. And the letters and bio sketches and training should be really explicit and detailed and consistent about when you're meeting, with who, and about what, because they bring up, oh, you said bi-monthly in this document, but then you said like every month in this document, and they'll notice. List your, if you have less experienced mentors, keep them as a co-mentor or co-sponsor. You can add consultants to fill gaps. But basically every content area and method should be matched to someone with expertise, and it's helpful to include a table kind of mapping people. Okay, so then not discussed, felt like it was hopeless, decided to go a totally different direction and submitted. This is again the summary statement from the next grant, totally different. Submitted to NIDA. The title is Modeling Combination Harm Reduction to Prevent HCV and HIV among people who inject drugs. In San Diego, the impact score was 32, and NIDA gave a percent, which I don't think that they actually look at for a case, but they care more about the score. So I was feeling encouraged because some institutes' pay lines are 30, and some people will tell you what their the score is, that like their pay line in advance, and some institutes don't. But so I was feeling better about this. But there were some critiques. So these are directly from the summary statement. So model validation was not discussed anywhere. Overall design is a bit shallow. Modeling procedures lack attention to detail, things like that. So insufficient detail in research plan is a weakness that people should pay attention to. The tricky part is that you really only have 6 pages, so you have to decide what details to include, but clearly describe data and the analysis plan, include a power analysis for each aim and hypothesis. Keep in mind real world scenarios. So is there attrition, missing data, control for confounding, include up-to-date statistical software. You can involve a statistician early if you have access to one. You can budget for statistical help in your grant. And then each aim ideally will have a clear and testable hypothesis. So some critiques I've seen for R21s that I've submitted are that it's too descriptive, or it's kind of like a fishing expedition. You don't have a really clear hypothesis that you're trying to test. And then the aims shouldn't be dependent. And I've actually had a grant where aims were somewhat dependent, but it described kind of, well, this is the plan B if it happens that an association is not found. And that was actually helpful, but as long as you kind of put that out there that you're aware, but it still could be a problem that people will probably point out. Lack of significance, innovation. So they said the scope of science is not very innovative. The proposed work is very West Coast centric. So ideally your work is exciting and innovative. It should have public health or clinical relevance, or move the field forward. If you have a particular population, kind of discuss the importance of that population or the potential generalizability from that population. Or for me, I was trying to make the case that I was learning how to do infectious disease modeling on the West Coast, but that I would develop a model that once I knew how to model, I could adapt for the country or for other settings. So kind of try and broaden the significance of your grant. And so I resubmitted quickly, maybe too quickly, this grant in September from getting, so you get the score back in July, and then I don't think you really get the full details until August. And so I had turned it around and noted the sort of lack of innovation. And I think they kind of mentioned that my grant was very similar to the work that Natasha Martin was doing. And so how was I kind of going to establish independence? And so I made this new focus on gender and looking at how harm reduction like differentially works by gender and impacts on health outcomes. But they did not, well, I think I just didn't have enough time to really include that aspect in all aspects of the grant. So then it went to a 40, which is not great and not fundable. So that was a disappointment. But I think I think the problem here is, so training goals must map to your research aims. That's really important. When you, kind of compare each together, your training aim with your research aims, and they should really make sense. But so I had included this research aim looking at gender, but I didn't include any coursework in behavioral social theory and methods surrounding gender. I had included outcomes for women. They did think it was innovative, so that was encouraging, but it didn't, I could better delineate fieldwork, training focused on gender disparities, how results from interventions would better serve women clients. So I didn't really follow through in terms of adding that gender component to the training. So new content and research aims should be covered in your training aims. Some people say write your training aims first so that it's clear what you're trying to learn through your research project. And the thing about a K is that people do spend a lot of time putting together their research project, but you shouldn't do that kind of at the detriment of your training goals, because that's an equal and potentially slightly more important component than your research project. Although you sort of never know in terms of the study section who you'll get. Some people look at your research program and as if it should be like an R01, but ideally this is a career development training grant, so it's just as important. And include a table of all the training courses and mentors and make it really explicit how your trainings will take place. And this is a section of a table that maybe I probably could have made less busy, but this was the funded grant, so it was okay. But so I kind of went through each training aim, develop expertise in the epidemiology and intersection of alcohol use and HIV. So who the mentor is, and then all of the different components of the training. So I was going to do a Uganda site visit. I have these courses that I'll take, directed readings, which are weekly meetings with the mentors that are relevant for this aim. What conferences will I attend? And then kind of lay it out by year. And then finally, this decided to resubmit the first grant, since the middle two did not work out, and got the score back in July, and it was an 18, and the program officer seemed excited about it, and everyone that at the study section was excited about it. So I was really happy in July of 2020. And what I had done differently is, actually, like looking back on that grant, there was really some low-hanging fruit that I could have changed. So creating research aim and training in alcohol use and HIV, that's kind of an obvious thing that was missing from a training grant. I added a senior mentor with expertise in alcohol research. So I had someone who had been working in Uganda on HIV and alcohol use for a very long time, but it was sort of later to the academic track, so it was still on a K. And even though that person would have been a great mentor and had a lot of expertise in the subject, because they were still on a K and appeared to be more junior, I think that was looked unfavorably by the study section. So I added a senior mentor with expertise, added a conceptual model, which kind of helped frame all the questions and research. They requested information about data specifics, and then I included a paragraph discussing all the potential limitations to the research plan and how I plan to address them. And also I had more papers published and some papers published in alcohol use. So I think that's really it. So also what was great about, but also kind of nerve-wracking about the timing is that, so it went through, it was kind of rushed because the end of the year budget, I think, was in September, So they had to get it through by September. And so then I started in October, and then I had a baby in December. And then, so that was kind of hectic, and it was the COVID times, but here's a picture of, I was able to take Vivi to Botswana, last summer or last September. So to continue projects there. So it's worked out so far. But happy to, if anybody has questions, or if people would like to email me after for advice or sections of my grant, I'm happy to share.
Great. Well, thank you so much. This was really informative, and thank you for sharing your, trajectory. And I think one thing that I can tell for sure is, I think, the resilience and the persistence that you showed. I think that's really remarkable and inspiring to see. And we have one question so far from in the chat, but I had a quick question about one of the slides that you showed where you outlined and kind of mapped your mentors and your training plan, and it was very detailed. And I thought it was really, helpful for the review. I wanted to ask you about whether it'd be worth mapping your mentors and the training aim with the research plan.
Yeah, I had thought that I had a table like that, but I didn't, because that makes sense to me now, looking, because I've had to review all of these summary statements for this presentation. But I think it does make sense if you can include that kind of table and definitely simplify it a little bit, but mentors, training, research aims, and how they all map together.
Yeah, that's great. So let's see. I know Ben Cow had a question. I think this is an important question. So do you need to secure a position at an institute first before applying for a grant, or is it the opposite? You need to secure a grant before successfully applying for a position at an institute?
I think it can work a couple of ways, and probably Jay, you can talk about it as well. But so for me, I needed the grant to secure the position, but I do know people who already have their positions who apply for a K, just to get some protected research time. So I think it can kind of vary.
Yeah, I think that's a good question. So, for a candidate to be able to apply for a career development award, you first actually need a commitment from the institute to basically, like, their administrative team, like the pre-award team, and the institute has to grant you approval to submit your proposal. And sometimes, and the commitment is, if you get it funded, you'll have office space and research facilities to carry out your study, because you'll get the funding to do it. But sometimes, like, the institute or the center director may not be too, like, 100% supportive of that. So that's something that you need to kind of negotiate with the institute or the center that you're working at.
Yeah, it can be a tricky situation in a way, because you need a letter from your university saying that they're willing to, that they plan to hire you.
All right, so Daniel has a question. Can you tell us about your experience in finding the right mentors who, in addition to having expertise in the field, accommodate the conditions and characteristics that this type of training scholarship requires in terms of their time invested?
Yeah. I think that I really lucked out in finding Natasha Martin, who I think you can kind of tell as you go through the application process, like how much people are invested in your success, and whether they have the time to give you the feedback and mentoring that you need. But I think that you do, yeah, that's also a tough question. So I think I looked out in finding her. I've had some other mentors who are on the grant who have been less available. But I think working with, if you find an initial mentor, kind of working with them to figure out who the other folks should be, and having meetings with several people and kind of doing a lot of networking if you can to meet people and see if your personality and research and things like that work together. But that is a tricky question. I don't know.
Yeah,
Jay,
I agree. I mean, I think to Dr. Wynn's point, I think having identified your primary mentor would be a really good starting point. And, you work with your primary mentor to really form your team. And I think one thing that, we should also consider is the mentor, the co-mentor or mentors do not necessarily have to be embedded in the same institution. So, your training needs will guide the specific mentors that would strengthen your application. So it could be somebody who's at some other university. And so it's forming that mentoring team that to Adriane's mapping table, like your mentors should really address your training needs. And then after you get trained, you'll be able to do the proposed research activities. So I think the mentoring team, forming the good team is a really important part of this career development award.
And you can hold meetings between all of your mentors during the application process too, like in the early stages, and kind of see how it all works out and get everyone's feedback. But yeah, it is kind of a process. But yeah, I think it's tricky because for a grant writing perspective, you want the people that are like the content areas and have the most mentoring expertise. But then you can include people with less experience kind of as co-sponsors to fill in some gaps.
Yeah, these are really great questions, and I'm really glad that we have time to go over these questions. So I'm monitoring the chat. Marguerite had a couple questions. Adriane, can you read them, or you want me to read them out to you?
I can read, yeah.
Okay.
Can you talk about your experience with the program officer? Let's see. So I had reached out to Bob Freeman, who is my NIAAA program officer early, and he is kind of a man of few words. And so I think really it was just to discuss with him kind of my CV and then whether the idea in general would, if it's something that NIAAA would be excited about. And I think he had some feedback about, they can't say a lot because their role is they don't vote on your or provide kind of feedback on your grant, but their kind of excitement or interest can kind of push the study section along a little bit, and they can be helpful to you. But I didn't have a ton of interaction actually with my program officer, but just to kind of confirm really, like, is this something that NIAAA is interested in? Are there any things that I can tweak, talk about kind of this, how it aligns with the Institute's strategic plan. I think that's mainly what our interactions have been. And then as I've got the grant, sending him papers that have been published and kind of just touching base throughout the process of how it's going.
Yeah, if I may add a couple more thoughts about the program officer. I think it's like to Dr. Wynn's point, it's good to reach out to them, but I think program officers are there's quite a bit of variability in terms of, how they engage with the grantee through the application as well as after. So as Adriane said, they don't have any influence in terms of how the review goes, but then once the reviews are done, and once you get the score, they can actually act as your advocate, and they can, kind of champion your application And some people are much more hands-on. Some program officers are much more hands-on than others. And some will be involved very early. Like my personal experience with my K, the program officer was very involved. He actually reviewed my application before submission and gave, comments, and, it took a couple of tries as well. And so he was very helpful, but not all program officers are hands-on. But I think one thing that's helpful is sometimes when your proposed plan is not quite in alignment with the Institute mission, then it's an important thing to find out early on. And that's what the program officer will tell you. This is really great, but our institute is not really prioritizing this area of research, for example.
Okay, share, the most challenging things and how I turned them around to my advantage. I mean, I think really the challenge was just getting so many rejections and reading. I mean, the summary statements can be kind of harsh, like, oh, you should have done this. You should, she doesn't have enough publications, this and this. So kind of just developing a thicker skin and realizing that, all of this critiques have helped me learn a lot more about grant writing and what people are looking for. And so I have a lot of feedback from reviewers and kind of see more about how they work and how they're thinking. So that's kind of the silver lining that I'm trying to spin of receiving all of these, like lower scores and negative feedback.
Yeah. Marguerite had a second question in the previous comment.
Oh, parental leave. Yeah. Maybe we can chat about kind of like the logistics of that after this talk, but it ended up being okay because I had put a lot of things in motion before I took maternity leave. So I was able to it was like publish and do things like that while I was off. But in terms of like the logistics of how it worked, like I'd be happy to talk to you about that after. Let's see. Oh, the difference between a K01 and a K99. I think the core difference is that the K99, although it's 5 years, the first two, you're still, I think you're still a postdoc. So it's still more of like a mentored award, whereas the last three, it's more of like you're doing your own independent research. I was watching a talk on this the other day, and so so you apply and you have your letter from the university, and then you do your 2 years of postdoc, and then I think you reapply to I think there might be another process where you reapply to the university to get a new appointment for the 3 years of independent research. But I think that's the core difference. I don't know if there's a difference in terms of the pay or the research support. I haven't looked at that, but that would be something to look at. I don't know if Jay has experience with that K99.
Yeah, I'm not too familiar with the K99 mechanism.
I was thinking about it when I kept getting
Is that what's called like Pathway to Independence Award or
Yes.
something?
Yes.
Yeah. So I'm monitoring. So Jonathan mentioned that he's interested in applying for a K43. Wondering if you had any thoughts or knowledge about that. I think that's for like specifically for low and middle income country scholars, right?
Yeah, I don't know much about the K43. Oh, I see. Oh, K43, is that what it's called?
Yeah.
I don't know how that differs from the K01, but
yeah, but I think the advice and the lessons that Dr. Wynn shared would be very relevant to K43 mechanism as well. And then some of these, K awards that were highlighted, you don't have to be a US citizen to apply. So I think it's important to explore different mechanisms and options. Let's
Yeah.
see.
I'll look into that.
Any other questions, reflections, thoughts? So I appreciate you managing our time well, Dr. Wynn. We have more time to have a discussion about this.
Everyone loves free time or if the meeting ends early too. Great. Well, feel free to email me. Does everyone have my email? But feel free to say, I could put it in the.
Yeah, I think Christine can
Okay.
share the email.
Okay.
Okay. Well, thank you so much for spending the time this morning with us, evening. I really enjoyed your talk, and it's good to see you again.
Good to see you too. Thanks, everyone. Good luck.
All right. And Christine, do we have any announcements for the fellows?
Kimberly, do you think we have any more announcements to share?
I don't think so. Thank you so much, Adriane. That was fantastic.
Yes, thank you.
I think I'm gonna refer people to this presentation because we're always
No.
if you don't mind.
Yeah, I mean, I think this is
always
really
getting questions about advice for care wards. So this is really
helpful.
really relevant.
Okay.
Yeah,
Great.
and then it'll be posted on our website, right?
Correct.
Okay, great. All right, thanks again.
Thank you.
Thank you, everyone. See you next month.
Thank you.
Thank you. Bye.